Too quick or too slow? How long should physical intimacy last? Plus, tips to cool down when you're too hot. Everything you wanted to ask about sex but didn't. Now you can ask Dr. Leah, sexual health expert and associate professor in the Department of Health and Human Performance. Here she is, Dr. Leah.
Thanks, Derek. It's great to be here today with all of you. I'm Dr. Leah Janine. We're here to answer your questions about sex and relationships. We have a lot of the latest research and a little common sense. Plus, we have a special guest here today to tell us what we need to know about testosterone and sexual health. But first, let's take on some viewer questions.
Ooh, testosterone expert coming up. Great. Awesome. Here we go. Question number one. A woman says, my partner has a penis ring and it hurts. Is this something they could remove? Does the piercing make it feel better for him?
Well, usually these piercings feel good. A piercing does provide more pleasure for the wearer because it stimulates more of their nerves. There are different types of jewelry that can be placed in the piercing, from a circular barbell, a captive bead ring, and even a wand. All of them can be removed and replaced for another different size or different shaped one. And
they feel good for the partner as well?
Penis piercings are also supposed to be pleasurable for their partner, as they can also stimulate more of the vagina, clitoris, or anal nerves. Maybe the type your partner is using is either too big or the wrong shape for you, but why not ask him to try a different type of jewelry?
So I guess that nose piercing doesn't sound too bad, actually. You know?
Yeah, I can imagine it would be pretty painful for a male, but you know, whatever you're into.
Yeah, I wish I could tell you, but I don't know either. But anyway, our second question, Dr. Lee. A viewer says, I am not sure I want to have sex. How do I know if I'm asexual or if I just haven't been in the right situation, Dr. Leah?
Well, let's define what asexual is first. Generally, it refers to a person who has no desire or little desire for sexual contact with another person. That doesn't mean they can't choose to be sexually active, whether through masturbation or sex with someone. Being asexual also doesn't mean that you can't have romantic relationships either. You may fall in love, get married, and have children.
All right, so the key is that it's not a choice, right?
Right. Asexuality is different from celibacy, and that asexuality is not a choice. Celibacy, on the other hand, is when a person voluntarily decides not to engage in sexual activity, even if they have sexual desires. It can last for a certain amount of time for your whole life. So are you waiting for the right situation? Only you could answer that. So you need to examine what that right situation would be and if it's realistic. Think about what would that be like, the mood, the type of person, and the timing. But don't jump into a sexual relationship unless you're certain that it's the right one. There are a few things worse than a bad sexual experience, but there are a few things better than a good one.
Great advice, Dr. Leah. Our next question, a man says, my partner wants to increase the length of our sex encounters, I guess, or a session, and we already go for hours. Wow. What's a normal amount? I feel like any longer is way too long.
Well, there is no set time on how long sex should last. Plus, everyone has a different way to define sex. Some people think sex begins at intercourse, but others think that it begins with foreplay. One study asked sex therapists in the U.S. to estimate the average duration of sex. They found that sex lasting under 3 minutes was a concern. Sex that's 7 to 13 minutes was desirable, and sex lasting 13 to 30 minutes was just too long. Then again, another study looking at the time it takes heterosexual women to reach orgasm averaged about 13.5 minutes, while other studies could even say it can last up to 20 minutes to reach an orgasm.
All right, so there's a lot of numbers there, so let me just recap this. So sex lasting under 3 minutes is a concern, 7 to 13 minutes was desirable, and sex lasting 13 to 30 minutes was way too long, but a woman takes 13.5 minutes.
Right. So obviously there's a problem here. And again, this is just according to therapists, right? No one had the timer out like, yeah, this is too long, right? So I think it really depends on the person. So I'm sure that woman who takes 13.5 minutes to orgasm is not saying that sex is too long at 13 minutes, right? So it could just depend on the stamina of the couple, and that could be sexual stamina, but it could also be physical stamina. I mean, depending on what you're doing, sex could be very active, and some people might not be able to hang in there for the whole time.
And yes, it also depends on their partner. So what does this mean for couples, for example?
Well, you should have a conversation with your partner and see if you are both on the same page when it comes to when sex starts, and if their sexual desires are being met when you have sex.
What if you want to make sex last longer?
Well, if you want to prolong sex, try taking a break when you or your partner is nearing an orgasm and focus on giving and receiving pleasure another way.
And what if you want it to go or be quicker?
If you want to finish quicker, try using sex toys or a lubricant to help your partner orgasm more quickly. Also, look for ways to increase sexual stimulation, like role-playing or maybe even watching porn together.
Still to come on Sex Talk. Initiating sex. Testosterone and fertility. Sex misinformation.
Initiating sex is important because it lets your partner know that you're into sex and that you're into them. Here are a few different ways that you can let your partner know that you are in the mood.
Spice up your love life by finding creative ways to initiate intimacy with your partner. Find a way to communicate to your partner that you're in the mood. Maybe it's something that you wear or a lamp that you turn on. You can be creative with your partner and develop a secret signal that only you two know. Make plans to take turns initiating. This can take the pressure off one partner who might otherwise have to do all the initiating. Alternate each time or week, whatever works in your relationship. Be spontaneous. Try something different to get your partner's attention. This could be a new look or an attempt to get intimate somewhere new. No matter what, be open and honest with your partner and make sure they're comfortable and consent.
Don't be afraid to ask your partner for their preferences and what they're comfortable with. Coming up, why a curved penis may mean more pleasure. And we'll have a guest who's here to tell us all about testosterone. That's next.
If you have a question for Dr. Leah, please send an email to questions@allhealthtv.com. Find out more about Sex Talk. Go to askdrleah.com.
Welcome back to Sex Talk. Today we have male sexual and reproductive medicine specialist, Dr. Josh White. Thank you so much for joining us.
Thank you so much for having me.
So, we know testosterone is important, but in your practice, how have you seen it affect sexual health?
So the two most common things that we see, particularly in infertility practice, is guys that come in that have a history of taking testosterone or anabolic steroids, and they're coming in because now they have concerns about their fertility. And so that's one aspect of it. The other aspect would be more related to kind of the erectile function and concerns over having low libido, et cetera, that they kind of associate with having a low testosterone.
So how does testosterone, either through natural testosterone or supplements, how does that affect fertility, and what might be the difference between natural and...
Yeah, for sure. So your body can't tell the difference between testosterone that's made by your testicles and testosterone that's made in a lab or in a pharmacy. And so what happens is that when the testosterone levels go up, your brain gets the sensation that or senses that the testosterone levels are elevated, and so it shuts down the production of natural testosterone. And that hormone is GnRH, and that's the kind of the main hormone that's made by the pituitary gland. So what happens is that creates LH and FSH, which make testosterone and sperm respectively. And so the production of sperm decreases if you're taking testosterone that's made in a pharmacy. In terms of the testosterone, it's a critical component of fertility. You can think of it kind of like the soil or water that would make that would be for making seeds if it was a pot, like a potted plant or something.
Okay, so what would be some natural solutions then? So if you don't want somebody going to synthetic testosterone, if they're trying to enhance fertility, for example.
Yeah, for sure. Now, in terms of the natural things to boost testosterone, there are some things that have been shown. So, healthy diet, exercise, specifically a Mediterranean diet is one that has been shown to improve testosterone and improve semen parameters. The other medications that are not necessarily natural but will increase your testosterone without affecting your fertility, those things include like Clomid or HCG, and those can be safe and are actually what we would use in men that have a history of, sperm suppression from taking testosterone.
Okay, so testosterone's obviously fascinating. In your own research or practice, what do you think is the most interesting part of testosterone?
So there's two things that I think are really kind of novel and quite interesting. So the first thing is there's a molecule called 17-OHP, and what that is it's a kind of middleman between cholesterol and testosterone. And so that's been shown in studies that we've done at the University of Miami to be a very good predictor of what the testosterone level is within the testicle. So, the testosterone that you get on a blood test is what your serum testosterone is, but that doesn't necessarily reflect what the testosterone within the testicle is, which is ultimately what drives sperm production. And so this is kind of a newer thing that we're using, and we're able to identify men that may have a normal serum testosterone but would benefit from medical therapy to increase their intratesticular testosterone. And then the other one is there's a nasal testosterone called Natesto. And what's that has been shown in clinical trials that we did is that it does not increase the hematocrit or thickness of the blood, and also does not impact sperm parameters in men that have normal semen parameters. So would be a very safe option in men that want to preserve their fertility.
And last question, what do you think is the greatest misconception or something that you really want our viewers to know about testosterone?
Probably the biggest misconception is that guys think, maybe I have erectile dysfunction, I need T. And that has been shown consistently in meta-analysis data to only improve the erectile function in guys that have true low testosterone. So taking more testosterone isn't necessarily going to make your erections better or sex better. And I think that that's something that we have to really educate our patients about, not infrequently.
Well, thank you so much. We'll be right back with more Sex Talk.
Still ahead on Sex Talk. Condom and lube allergies. Curved penis a problem? Sex myths debunked. Hormone replacement therapy for men. Sweaty sex a turnoff?
Back here on Sex Talk, let's take some more questions from our viewers.
Excellent, Dr. Lee. We're halfway through question number 4. A woman says, I think I'm allergic to condoms or the lube. How do you know if I have an allergy?
If you're having an unexplained and frequent itching after sex, it could very well be an allergic reaction to either the condoms or the lube. Some other symptoms associated with allergic reactions are redness, bumps, swelling, and hives.
Okay, well, what are some of the common culprits?
Well, it's possible that any type of condom could be the cause. The ones that are made of natural latex are the most common to cause a reaction, and most latex allergies develop slowly after repeated exposure. While most people only develop symptoms in the area where there was direct contact, in severe cases, some people, and typically it's women, can have what's called a systematic allergy reaction that can affect the whole body. Even condoms that are synthetic can cause an allergic reaction depending on what the ingredients are, like added spermicide.
Interesting that the natural latex ones also can cause that, huh? I would think otherwise. And how about the lube, Dr. Leah?
The same goes for lube, so check the labels and try trying different brands of condoms and lubes to see if that itching goes away.
Should you get officially tested?
It's never a bad idea, especially if you're not in a monogamous relationship and something's seeing wrong down there. Absolutely get tested. If anything, it'll just ease your mind.
Okay, so if you think you're allergic, is it okay to just switch the type of condom or lube that you use?
Well, yeah, and again, if you're in a monogamous relationship or you've eliminated the possibilities of STIs, then switching it would seem to be the most important.
Great. Okay, our next question. A man says, I have a curved penis. Do women prefer it, or does it make sex worse?
Well, a curved penis can offer a number of pluses, depending on the angle of the curvature and how it is curved. One plus is that a curved penis can cover a larger space than a straight one. An upper curved penis can also be better at reaching the more pleasurable spots inside a woman, allowing the penis tip to rub against the vaginal walls. Well, having a slightly curved penis is nothing to worry about. If the curvature is significant or it's new, you could have what's called Peyronie's disease. Talk to your doctor and make sure that there are no health problems, and if there are, you might want to seek some help with treatment.
Okay, these treatments, what are they, for example?
Well, you've got injections that can actually help break up the plaque that's causing the curve. There's also a vacuum device that over time can help with this. And if it's really bad, there is surgery that can remove the plaque that causes the bend, the sharp bend. Usually with Peyronie's disease, it's going to be right or left. And that surgery can correct it and make it all straight.
So in other words, there's no magic pill, no supplement, no vitamins, or is there?
So what's interesting about this note, there isn't a magic pill, but I was actually just reading a study the other day saying that lack of vitamin D could contribute to Peyronie's disease. And as I always say, if you do already have Peyronie's disease, you want to make sure that you're not just loading up on vitamin D. You want to make sure that you in fact have a vitamin D deficiency. If you don't have a vitamin D deficiency, loading up on the vitamin is not going to help. So typically you want your vitamin D levels to be about 50 nanomoles per milliliter of blood. Anything below 30 is actually really bad. And I will tell you, I am somebody that lives on the beach, obviously living in South Florida. I'm out in the sun all the time, which helps with vitamin D. And anything below 30 actually puts you at risk for weak bones and a whole slew of other issues. And my level was 12, which was very, very, very surprising. I eat healthfully. I'm doing all of the right things. So vitamin deficiencies are a real problem. And so it's something I would really recommend people looking at, even if you live in sunny South Florida.
But okay, so you said you just lay in the sun, but did the sun give you vitamin D, or does it help you metabolize? What? Because I've heard so many different things about the sun doesn't give you vitamin D. Is that correct?
Well, so being out in the sun could trigger it in your body to release the vitamin D. So it's not like the sun is just shooting vitamin D at the speed of light coming out at you. So it's not quite like that. That would be really interesting if it were. So it is not that. It's just the way your body is reacting, not that it's flying through space to come get you there. But students actually have asked me something very similar to that. But yeah, being out in the sun can help. Obviously, then it puts you at risk for other issues like skin cancer. So you have to kind of balance everything. But I'm not somebody that I would have thought would have been that vitamin D deficient. So if you're not consuming enough fat with your vitamin Ds, then your body, it's a fat soluble vitamin, and so it's not going to be absorbed as well. So if you're on a low fat diet, that can be partially the cause. But vitamin D deficiencies are very, very common.
Thank you, Dr. Leah.
If you have a question for Dr. Leah, please send an email to questions@allhealthtv.com. Find out more about sex talk. Go to askdrleah.com.
There are a lot of sexual health myths out there. Here are a few of the more popular ones.
Sex misinformation is on the rise, especially with the use of social media. Don't be fooled by these trending myths. Some women think sex always leads to discomfort. While some women may experience pain or discomfort during sexual activities, it's not a universal experience. Pain during sex can have various causes, including medical conditions, psychological factors, or insufficient arousal. Another myth is that certain positions can be used to prevent pregnancy. The reality is that the positions during sexual intercourse do not determine the likelihood of pregnancy. Conception can occur regardless of the sexual position. It's the presence of sperm and the timing in relation to ovulation that are the primary factors in determining the risk of pregnancy. And when it comes to STDs, they are transmittable even during oral sex. Infections such as herpes, gonorrhea, syphilis, chlamydia, and HPV can be contracted through oral genital contact. Using barriers like dental dams or condoms can help reduce the risk. It's important to cross-reference for accurate information. If you're unsure about something, talk to a healthcare professional.
We talk a lot about myths with aphrodisiacs, oysters, dark chocolate, and strawberries. While there may be some truth to those, there really isn't a lot of research. Let's take on some more questions.
Beautiful. Here we go, Dr. Leah. A woman says, I recently have been exploring my body more and notice I have a very small vaginal opening. What does that mean?
If you're a younger woman and you haven't had sex yet, what you might have is a microperforate hymen. It's a rare congenital condition that leaves only a small opening in your hymen instead of a ring-like tissue that usually surrounds the opening of the vagina.
Are there any other symptoms, Dr. Leah?
Yeah, well, some of the symptoms of this condition are no periods or ones that last longer than 7 days, or difficulties inserting or removing a tampon. This condition can resolve itself, sometimes around puberty, by expanding on its own, or tearing after trying a tampon or having vaginal sex. If it doesn't, a minor surgery can remove the extra tissue.
Would there be any other causes for that?
Well, if you're referring to the actual size of the vaginal opening, some women do just have narrower vaginal canals, or in some cases, things like surgery, age, or cancer can actually cause the canal to narrow. There are several treatments that can help, including a vaginal dilator that can slowly increase the elasticity of your vaginal muscles. Cysts can also form in the skin surrounding your vagina and partially block the entrance.
Great. Our next question, Dr. Leah. A man says, my doctor suggested HRT. Are there any risks or alternatives? What is HRT?
So HRT, otherwise known as hormone replacement therapy, works by replacing hormones that are naturally low or out of balance and can improve physical and mental health. In men, HRT is different from TRT, or testosterone replacement therapy, which deals mainly with testosterone levels in men. HRT for men focuses on thyroid or adrenal imbalances. This can help balance other hormones like testosterone levels. Some benefits are increased energy levels, improved libido, mood stabilization, and muscle gain.
So are there any side effects, positive or negative, on this?
Well, because HRT can lower the level of testosterone, it can affect your ability to have and maintain an erection. This may get better in anywhere from 3 to 12 months, but other side effects could be you're tired or having hot flashes, sweating, weight gain, memory problems. Most of the side effects are worse at the beginning of the treatment, and then some or most hopefully will go away within a few weeks.
And what about if other alternatives?
Yeah, you should consult with your doctor on alternatives, just depending on your condition.
Dr. Leah, a viewer says, I sweat a lot during sex and I know it's a turnoff for my partner. What can I do besides wearing a headband?
Oh, yes, like the 1980s workout band.
There you go.
That might be a much larger turnoff than any amount of sweating.
That's question number 9. Okay, go ahead.
Yeah, there you go. No, we're not. I mean, I guess all trends are cyclical, so it could come back.
Dr. Leah, forget about the sweatband. This is a serious concern this gentleman has. What can he do?
Well, sweating is a natural function, and it can mean good things during sex because you release pheromones that act like an aphrodisiac to increase your partner's arousal. Sex, like all physical activity, raises your heart rate and body temperature. And speaking of raising the body temperature, hot, sweaty sex can be, well, hot. It means that the momentum is building and you're letting your urges take control. So don't worry about getting sweaty and don't feel uncomfortable about it.
Whew, it's hot. What if the sweat is just becoming too much, Dr. Leah?
Well, if you're concerned about this, what about trying to lower the room temperature by opening a window or upping the air conditioning? South Florida opening a window might not help. You might also want to try different positions during sex that will increase airflow around your body, like being on top or being in doggy style, or switch it up. Get into a position where your partner's doing the work so you get a break and then you're not sweating. But you definitely want to talk to your partner about it if you feel like it's affecting your relationship, because the reality is your partner might not actually find it that big of a turnoff. It really could be predominantly in your head. Well, Derek, that's all the time we have for today, but you can still send in your questions. I'm Dr. Leah Janine, and we will see you next time when we answer the questions you've always wanted to ask on Sex Talk.